The UK is facing a crisis in its care home sector. The system is struggling to cope with an aging population and rising demand. There are not enough care home beds. Many people are finding it difficult to access the care they need. This is a growing problem that is putting immense pressure on families and the NHS. The care home crisis is a complex issue with many contributing factors. One of the main issues is funding. The government has been cutting funding for social care for many years. This has led to a decrease in the quality of care and a shortage of staff. Families are often left to fill the gap, providing unpaid care for their loved ones. Another major issue is the low pay and poor working conditions in the care sector. Care work is often seen as low-skilled and low status. This makes it difficult to attract and retain staff. Many care workers are leaving the profession for better-paid jobs in other sectors. The care home crisis is having a devastating impact on families across the UK. Many people are forced to sell their homes to pay for care. Others are forced to give up work to care for loved ones. The crisis is also putting a strain on the NHS as people are being admitted to hospital because they cannot get the care they need at home. The care home crisis is a national scandal. It is a disgrace that in one of the richest countries in the world we are failing to provide adequate care for our elderly and vulnerable citizens. The government needs to take urgent action to address this crisis before it is too late. The scale of the care home crisis is immense. Over 2.6 million people over the age of 50 in England alone cannot access the personal care they need. This means basic help with daily tasks like washing, dressing and eating is out of reach for a staggering number of people. The impact on their quality of life is immeasurable. Adding to the pressure, the NHS is grappling with its own crisis. A staggering 7.5 million patients are stuck on waiting lists, a situation made far worse by the lack of social care options. When people can't get the support they need at home, they often end up in hospital, taking up beds that are desperately needed by others. The care sector itself is facing a severe staffing shortage. Over 130,000 vacancies plagued the sector in 2023 to 24, a stark illustration of the crisis at hand. This shortage is projected to worsen with a predicted shortfall of 64,000 care home beds by the end of 2024. The system is buckling under the weight of demand. These figures paint a bleak picture of a system struggling to cope. The care home crisis is not a distant problem. It is affecting millions of people right now. Urgent action is needed to prevent the situation from deteriorating further. At the heart of the care home crisis lies a chronic lack of funding. The amount of money the government provides to local councils for social care has been steadily decreasing since 2010, despite the soaring demand. This means less money is available to provide care for those who need it most. The cost of care itself has been skyrocketing. Individuals with assets exceeding £23,250 are required to pay for their own care, a threshold that has remained unchanged since 2010. This means a significant number of people are dipping into their life savings, selling their homes, or relying on family members to shoulder the financial burden. The situation is particularly dire for those who require residential care. A staggering 1 in 7 care home residents ends up paying over £100,000 for their care, a figure that is simply unattainable for most people. This financial burden can have devastating consequences for families, often wiping out their entire life savings and leaving them in a precarious position. The government's recent allocation of an extra £600 million to social care, while a step in the right direction, has been widely criticised as being woefully insufficient to address the scale of the crisis. The funding gap remains vast, and without a significant increase in investment, the situation is only set to worsen. The care home sector is heavily reliant on its workforce, yet it faces a catastrophic staffing crisis. One of the main reasons for this is the low wages offered compared to equivalent roles in the NHS. Care work is often physically and emotionally demanding, yet the pay does not reflect the level of skill and dedication required. The prevalence of zero-hours contracts within the sector exacerbates the problem. These contracts offer little job security or guaranteed income, making it difficult for care workers to make ends meet or plan for the future. This lack of stability and financial security contributes to high turnover rates and makes it challenging to attract new recruits. Past policies that restricted overseas carers from bringing their families to the UK have also played a role in exacerbating staffing issues. These policies made it less attractive for skilled care workers from abroad to seek employment in the UK, further depleting the pool of available talent. While a record number of men entered care work in England in October 2024, largely due to eased immigration rules, this is only a drop in the ocean compared to the scale of the crisis. The government must address the root causes of the workforce crisis, including low pay, poor working conditions, and the lack of career progression, to attract and retain the dedicated individuals needed to care for our aging population.